Hi and welcome to tonight's live, where I'm really looking forward to speaking with the lovely Dr. Genia Rozen about a topic which I'm really pleased is receiving a lot more attention lately. And we're here to answer your questions about using donor eggs. Now let's see, looks like Genia's coming in here. Hang on a moment. See if we can join us there. I can see you've popped up, Genia, there, so hopefully you can join me shortly. Because for those who don't, here we go. There we go. How are you, Genia?
Hello. Sorry, did I join too early?
No, not at all. No, I'm always pleased to see when this works and technology and we're getting all up and running.
Surprising, isn't it?
It is. So, but I was just going to give you a great introduction. So I'll continue to do that. So for anyone who doesn't know Genia, you're a gynecologist and fertility specialist, and you did your training here in Melbourne at the Royal Women's Hospital, in which you're a consultant. And you do have a special interest in fertility preservation and particularly oncofertility. And let me get this right, because I think I messed it up last time. You're deputy head of the well-known fertility preservation service at the Royal Women's Hospital. And you're also doing a PhD as well, just to throw that in the mix on top of everything else.
Why not?
Yes.
Been doing it for a long time, yes.
Yes, you obviously have a big passion for that area, and I know you have your private practice in East Melbourne and the Mornington Peninsula, where patients can see you, and you share my passion for the outdoors and nature and life in general, and really creating and supporting life in general. So I'm pleased to have you talking about donor eggs, which I was just saying before is a topic that is gaining, I guess, more interest, and people are becoming more aware of it, which I'm finding really exciting, because probably as you have, I've seen a number of patients through some amazing journeys with donor eggs, and it's so exciting to see that now an option. So first of all, I've got a number of questions that have come through. So if anyone wants to ask questions, feel free to pop them here and I'll be sure to cover them. I know a few people messaged me beforehand, just wanting to ask some anonymous questions. So I'll start off with, I guess, the basic one. Where do people start? It's not something, you know, Google's a scary place. If you're thinking this is an option, where do you start with looking into donor eggs?
So I guess even before that question of where do you start, I guess the question is who are donor eggs for? I mean, they're certainly not the first point of call for most people that we see. Most people want to use their own eggs, and if that's possible, then that's definitely the way that we would go for most women or for most couples who are trying to have a baby. So who is it that really needs donor eggs or wants to use them? And there's many different scenarios where that can take place. So for example, there are women who have run out of eggs, so have ovarian insufficiency, which is premature, so they still might be very young, but their own egg supply has run out, unfortunately, and they are looking to conceive donor eggs. Using donor eggs means that if they have a partner, they can still use their partner's sperm combined with that egg to create an embryo, which can often still go inside of their uterus, because even if they've run out of eggs, their uterus is often still very much robust and able to support a growing pregnancy, and they can have a very healthy pregnancy. In that setting, we would use artificial hormones. So because their own ovaries are not producing hormones, we would give them those medications to prepare the lining in order to support the embryo and help it implant. So that's one type of situation. Another situation is in a more of a medical way. Some women have had their ovaries perhaps removed due to a medical condition, or their eggs have been affected by chemotherapy treatment, for example, or other treatments that render them infertile in that way. And finally, we sometimes use donor eggs within a same-sex couple. So if there are two women in a relationship who are having a baby, sometimes we use one of the women eggs from one woman in order to create an embryo, which then goes into the other partner to have a baby, so that they can both have involvement to create their family. So they're kind of the common types of settings that we start wanting to use donor eggs.
Yeah.
And the other big one, of course, is age. So you may not have run out of eggs, and we might have tried treatment with someone's own eggs, but because of their age, the quality is just not there, and we're not able to help them, even with, you know, throwing everything that we absolutely.
That is a question that I did get, is in regards to age. Is there a limit? You know, how far can you go with egg donation? Is there a limit onto how old you can be?
So, well, if there's a woman who needs an egg donor, or if there's a woman who's using an egg donor, then her own age is no longer as significant as before. So a woman can use donor eggs in our clinic up to the age of about 50, 51. And that's sort of the rationale behind that age, is that that's the average age of menopause. And so sort of, you know, the expectation is that some women still can get pregnant up until their menopause. And so we can certainly treat women with donor eggs up to that age, and sometimes, depending on, you know, individual circumstances, even beyond. Because we know that women, even if they're in their mid or late 40s, can still have very healthy, normal pregnancies. So being fit and well, those things really reduce the risk of pregnancy complications. You know, things like preeclampsia, etc., can really be reduced by being healthy. Unfortunately, our eggs are more fragile, less robust, and even if we're a very healthy person, but in our mid-40s, for example, often the quality of eggs is just not there.
Yeah, but getting healthy, preparing your body, and then having the donor eggs, can make all the difference. And it's great that we are able to, as you said, help people who may have had cancer treatments or other things that have rendered them infertile. This gives them that option to be able to have a child. Absolutely. So another question that did come through was, doing standard IVF, what is the difference? So, you know, we've got standard IVF medications. Is there any altered medications? What's the difference in doing a donor cycle versus a regular IVF cycle?
Yeah, so if we are lucky enough to have donor eggs at our disposal, and we have our partner whose sperm we're using to fertilize those eggs, and we've created embryos from those eggs, then all we need to do is prepare the lining, the endometrium, to be kind of at the same stage of development as the embryo. Yep. So the embryo is usually either frozen or fresh on day 5. That's when we usually transfer that embryo, on day 5. That's day 5 after ovulation of the egg, or collection of the egg. And so the lining kind of needs to get up to speed. So there are different ways to prepare the lining. For example, for women who still do have ovarian function, we can use their natural cycle, so we don't have to give them artificial hormones. Okay. And it works just as well to actually use their own estrogen that's being produced, and then once ovulation occurs, then their own progesterone after 5 days to put the embryo in. And of course, we're looking at their lining on ultrasound. We're testing their bloods for those hormones. The other way, so for someone who doesn't have any ovarian function, we don't have that option of them producing the hormones, and then we use artificial hormones, so using estrogen that they can take, for example, orally. There's also estrogen patches. There's different ways of administering it. And then again, after the lining is a certain thickness or looks a certain way, we would then start the progesterone and use that for 5 days before the lining's ready then to have the embryo transfer.
Yeah, so basically creating that natural cycle that the embryo transferred into. So
exactly, we're trying to recreate what nature's done, essentially. And the really important thing there is that because we've already got that embryo, in a way it's much simpler than that full stimulation cycle that we associate with IVF, of having to have the injections, which then stimulate the follicles to grow, collecting the eggs. So that part is already kind of done. It's disconnected from that part, and we're just doing the endometrial preparation.
Excellent, because that was another question I had. Is there any additional medications, and I guess are there any risks involved in donor eggs versus your own eggs? What's
in general, we're using donor eggs to try to reduce complications of, for example, or increasing our pregnancy rates or reducing our miscarriage risks, which is, of course, as we get older, chance of pregnancy goes down and the chance of miscarriage going up. So it reduces that, actually. The chance when we're using donor gametes, that's sperm or eggs, very, very small and largely theoretical chance of infectious diseases. But we, the donors are screened for those things. So that's really important to do. So things like hepatitis, HIV, and a number of other infectious diseases are screened for. The other things that, depending on whether it's a donor that is known donor, so most of our egg donors are in fact known, then you may know some of their genetic history and medical history, things like that are really important. If it's not a known donor, a clinic donor, again, that information is all available. And really, it's a very complex, the medical side of it is almost not as complicated as kind of the other aspect of, what our donor team's actually involved in. It's a very complicated pathway because the expectations and things, when it's theoretical, at theoretical level, may of course change when there's a child involved. So, for example, if it's a known donor, a known or recipient recruited egg donor, again, working out some of those relationship things, it's really important up front because there's bound to be, unexpected things that happen, and the more you can sort of arrange and try to work through, sometimes even legal agreements are drawn up. So that's what our donor team is for, to navigate that very complex landscape.
So you have that support. Then before we jump into that, I just sort of question pop through, which I think we did answer. It was just what is the upper limit? There was a number of people asking me that through messages. So I think we did sort of cover that as around that sort of 50, 51 you said is ideal.
Yeah, so that's for the recipient who's using the donor eggs, for example. If the question maybe is around how old can a donor be, because and patients do ask me this because, of course, and I'm sure we'll speak lots about this, donors are so hard to come by. There are no donors lining up, to donate their eggs. I have had some lovely patients recently who've sort of become a bit more aware of the situation and the real desperate need for donor eggs, and they've actually volunteered to undergo cycles to become egg donors for the clinic. But these women are far and few between, and so because there's such limitations, patients will ask, well, I've got a sister who's 37 or 38, is she a suitable donor? Because of course overseas in other jurisdictions where donor eggs can be bought, they have really strict, very young cutoffs for their donors, under 34. And because basically they're able to still get very young donors, whereas here we would consider accepting a donor, for example, who's fertile, who's had children, even in their later 30s, because for that person, their sister may be the only option to get eggs from. And certainly our pregnancy rates for women in their late 30s are really quite good now. So someone who's fertile would potentially be quite, give quite a good chance of success with her eggs.
So it's really looking at their fertility rather than the age per se. It's how
certainly taking that into consideration and what the options are. And we wouldn't reject someone just on the basis of being in their later 30s. It would be a discussion about the pros and cons and what else, what other options are available.
So you talked about the team that you have there, which is obviously a great support for people because, as you said, it's not just about the biology that we're talking about here. This is creating a life. This is involving more than just the one or two people in creating that life. So what is involved? What does your team look like, and what sort of support can people expect? Where do they start?
Yes, the fertility specialist is a good starting point to kind of start to navigate through the rest of the process, because the first discussion is medical. It's related to, you know, what are the options, what are the choices, where are we going to go from here? And then, you know, if you've picked your donor, then it's seeing the donor, assessing their medical situation, making sure that they understand the medical aspects of treatment, because of course anything you do, you know, any medications you take, there are risks, there are side effects, and it's making sure that they really understand what they're getting themselves into. And then if there's still, you know, that interest, if things are, if they want to move on, then they meet with a person from admin to guide them through logistics of the treatment process. And they meet with the donor team, the counsellors. As part of the donor team, there's also the donor nurses. And they have a couple of donor team consultations, so it's not just the one. And sometimes it involves not just the couple who are the recipients of the donor egg. There'll also be obviously the egg donor, but then also if that egg donor has a partner, they're involved in the process as well. Everyone needs to be on board, everyone needs to be informed.
Because as you said, this is about creating families, not just biology. This is families, relationships, exactly. Long-term relationships that you want to establish.
And even if it's exactly right, even when it's a clinic donor, so not a known donor, there's still, you know, as with any gametes these days, there's still this ability for the child when they turn 18 or are considered mature for them to be able to contact their donor. And that's done through VARTA, which is sort of the Victorian regulatory body for fertility treatment. It's no longer that, you know, donors are anonymous and that there's no way of finding anything about them or being able to contact them directly, because basically in the interests of the well-being of children who want to find out more about their biological origins.
Yeah. I think that's important to understand as well. I know I did a podcast for the Conceive Baby podcast with the VARTA representatives, Louise, and on that situation. What are your rights? What are your options? It's good to know all the legal standpoints when you are going into this with your eyes open. And that's the other question. We've sort of touched on it, but the not having a known donor. So if you don't have yet the option of a friend or a sister or someone who is able to be a known donor for you, going down the unknown donor path, first steps, how does that look like?
So it looks initially the same way, in that you would still come through the medical, the sort of fertility specialist, and go from there. The real limitation though is the supply, because demand far outweighs supply. And so the donor waiting list in most places is just long, you know, it's years, and most women don't have years to spare, which is why these women who can't find who don't have a donor that they can, you know, that they can think of in their life, you know, they sometimes advertise for donors, and clinics can usually help with that. But failing that, a lot of women used to go overseas for treatment. They used to. Things, you know, have turned a little bit upside down in the world with COVID, and it's made it even more difficult. As it is, going overseas certainly has downsides, you know. Some of the obvious logistical aspects of going overseas, but also, you know, there's not that regulatory framework as there is here, and so you're going to, you know, it's a leap into the unknown somewhat. Many of the clinics overseas, they do only anonymous donations, so, you know, the child potentially has that issue of not being able to contact their donor in the future. There's lots of potential ethical, medical sort of implications of going down this path. So it's fraught. It's an area that's fraught, and now with COVID restrictions on travel, it's almost made it really impossible to get eggs that way, and
Yeah.
thus even more of a desperate situation with
Yes.
regard to eggs, and which is what sort of has prompted our recent, published recently an article in BMJ Ethics, an ethics journal, arguing that there may be a way to address this desperate situation and in a way sort of try to, in a way, address two unmet needs. And so basically the idea of it is that women undergoing elective egg freezing, so these are women who are maybe single and worried about their age and freezing eggs. Most of these women we know actually don't come back to use the eggs, or at least so far that's been our experience. Of course, in the future, as more years lapse, that might change, but at the moment very few women actually come back. And and there's more and more cycles that are being done in this setting. So the idea basically is that these women who no longer require their eggs, once they've made the decision, for one reason or another, that they don't need those eggs, that they may be able to donate the eggs to a woman who needs them, and in turn have the costs that they incurred doing the egg freezing process reimbursed. So it's kind of in a way not very different to the current situation where if you become an egg donor, you will donate your eggs and of course you won't pay for donating your eggs. Your fees, your time and cost will be compensated by the person that's receiving those eggs. So in the same way, it's kind of, although it's separated in time because you incurred the costs many years ago, but it's reimbursing those costs, so that it kind of can draw extra sort of attention to the fact that these eggs are needed by other women, and that may encourage women to donate their eggs if they no longer need them.
And congratulations on that article. That's what made me reach out to you today, because I think that's just such a wonderful thing to be looking into and looking at what are these options for women, because there are more and more women who are in this boat who are at an older age. We aren't having our children, in our 16 anymore. We are, sort of, so 36 to 40 would be my average patient, I think. So it is a lot.
Yes, and probably mine too.
Yes. So we are having babies a lot later, which does increase the risk of all those complications. So congratulations on that research. I saw you were on the Today Show as well, talking about that as well. So it's great to see the more awareness, because any of the patients that I've seen through egg donation, as you said, it's not the number one choice. It's not something they went, yep, I'm going to just choose to have a baby through egg donation. But it is something that after multiple cycles and seeing that it's most likely not a viable option to have their own babies. And I've had patients that, even probably yourself, who said, no, I'm not going down that path, never go down that path, who then slowly take the steps. And I have to say, in my experience across the board, it's been such a wonderful outcome.
Exactly. I mean, after sort of the trauma and that roller coaster journey of trying, for example, unsuccessfully to with their own eggs to have a baby, and kind of not being able to give up on that dream of being a mother, let's say, or being parents, having that suddenly that opportunity to increase your chances, your odds by so much, going down the donor path and having that success, it kind of levels the playing field really, and just turns things around. And when my experience with my patients is, by the time they've gotten around to that decision making and they have their baby, there's just no, their initial hesitation is just so far, in their brain forgotten about, when they've given love to that baby from day 5 really.
Yes.
Of that embryo, and they've nurtured the baby inside their own body, and then the love that they give to that child, sort of, it just makes other things pale in comparison. And for some couples, it's a journey where it is an egg that's donated, and so the biologic, the sperm still comes from a partner, so biologically they're still at genetic connection to the male. Some decide that because there is no connection from the maternal side, that they actually they prefer if the sperm was also donated sperm. So they might go for the donor embryo option rather than donor egg. So there's lots of different ways to actually think about it. There's not just the one way. But in my experience, certainly couples have gone down this path, or women have gone down this path, have had the most amazing experiences. And we actually had on the Today Show Donna, who is actually a midwife in Queensland. She's actually working on this whole resilience program as inspired by her own IVF journey. She has donor conceived children. She just relayed how, you know, the miracle that it is, and her amazing experience having finally created her family.
That's wonderful to be sharing. I think, is it Conceiving Mind? Sorry, Donna, if you're watching, and feel free to tag yourself or something so people can follow what you're doing and really.
Yeah, I should have let her know that we're going to be talking about her.
It just triggered me then. I'm like, oh, I remember seeing her post, and I'm sorry if I'm messing that up, but feel free to post below this or something, and so people can follow your journey as well, because I know I did see that she's taking some wonderful steps in getting the awareness out and sharing her journey, which is wonderful. I know I did a podcast a while ago on the egg donor topic, and I got an email from Europe, actually, from someone who had been through donor eggs, and just such a beautiful story. Please pass on this information, that it's just so wonderful. And I was so resistant, and it was a really beautiful. There you're there. Hi, Donna. Lovely to see you. Yeah, so if anyone wants to follow the Conceiving Mind, if you want more information about egg donation and your journey. So thanks for being there. So the other thing I have been asked about is, I've covered sort of how a donor's selected in a way, success rates. I mean, we sort of hinted at it bumps up the success rate quite considerably. So what are we looking at success rates?
Yeah, so the best way to sort of describe success rates in the setting of using donor eggs, it all usually almost entirely comes back to the donor's age. So if you're using a young donor, or as I said, a semi-young donor, but with, you know, proven fertility, the chances really are similar as to what that donor would have at pregnancy. So in other words, the uterine factor for most women is not a significant issue. Of course, there are lots of different individual circumstances. You know, there's women who have very severe adenomyosis, for example, who do have a significant uterine factor, or, for example, if their uterus, if they've had radiation treatment. So there's individual exceptions to this overall rule, but for most women, the success rate will be the same as that donor's age. For example, in our clinic, a 30 to 35-year-old having IVF treatment can expect with a day 5 embryo to have about a roughly 40% chance of pregnancy. So that's kind of what a recipient using that donor egg would roughly have as well. And often, you know, their own chances are, you know, something like maybe 5% or even less. And so that is a significant increase. And still, you know, it's still a journey. We have to remember that nothing about this, you know, reproductive sort of area is a one-stop shop. So, you know, even with a donor egg, we don't expect for it to definitely work after one embryo transfer. We have to accept that we may have to do it a number of times. But if we're able to give the patient a really high chance each time, then that's kind of, that's fantastic, really.
And I think that's what it is. It's about optimizing your chances. And as I said, I always talk to my patients, we are dealing with biology. So there is a little part of this that is beyond science, beyond our control. But if we can get as many things in place to, as you said, get them really healthy, get you in a really well place to receive that egg, and a really emotionally and physically place to give it the best chance, give it the best home that we can to create that pregnancy.
And that's what I talk to my patients about, that ultimately, you know, there's so many things outside of our control, and they're kind of big ticket items, but they're outside of what we can do. the other things about our lifestyle and our general health, our well-being, you know, where our mind is, those, if we can control some of these things and make positive changes, then we should be grabbing every single one of those little things.
Yeah.
Because
yeah.
they're the only things we can control.
And that's the thing, and that's what I always talk to a patient about too. Our age, we can't change that. We can't change the age factor, but we can control what we're eating, what we're doing, what our nutrition is, you know, getting the right nutrients. I know I'm seeing a couple of couples, literally their egg donor and the recipient. So that we're getting that, she's paying for the supplement, so just see her, we'll get her, you know, the good eggs, and so just giving them the best chance possible to produce viable eggs and give them the best chance of getting that viable pregnancy, because that's what it's all about. It's creating a family, creating a life, and as I said, from the couples that I've seen, the journey is just so beautiful, and at the end, you know, I have to say every single one has said, this is what I was meant to have, this is the baby I was meant to have, and for whatever journey I had to go through to get there, this is where I was meant to be, and this is meant to be my baby.
It wasn't plan A, but definitely everything they ever wanted. And I guess picking up on the point you mentioned before, I guess also sometimes there's a lot of guilt. People might have a lot of guilt about some of the things that they, you know, either their weight or, you know, whatever it may be. And I guess also recognizing the fact that some things, a lot of things, and such as their age, are outside of their control, which is making the most input. And so really they shouldn't feel guilty about those small things either, because you know, that's not what's making them infertile usually. And it's not, you know, it's nothing that they've done wrong. The big things are still the big things that are outside of their control. So not to, I guess, overly focus on some of those things as well, you know, to keep, I guess, the big picture in mind. And that's sometimes hard to do when you're on this roller coaster journey.
But a really good point, because I think the guilt is such a big thing that women kind of gravitate to. I don't know, it's a natural, it's my fault, there's something I'm doing wrong, and you try to, that self-blame. And I do like to, I agree with you, take that off the table. You know, that doesn't, not productive for you. And as you said, it's not even based on any science or fact that you're blaming yourself. So I like to look towards the future. What can we do? What best next step can we take? And that's all we need to do. Let's focus on the now. What's the best next thing we can do to move you closer to your baby from here? So good point, to get that support and get that counselling around that as well, so you can feel confident going into this journey.
Absolutely.
So I think I've covered off most of the questions, but I'll just make sure that I've covered the ones that came through. So the other thing that was touched on, I guess, is maybe variable, but cost.
I usually try to avoid all cost questions.
And that's what I figured when I saw it come through. I'm like, I'll throw it out there, but yes.
I find that by the time I've sort of finished a consultation, going through all the medical aspects of things, I just, you know, there's just no room left for cost. And really, I don't know whether it's a subconscious thing, but I can't remember figures in my head either. But yeah, no, it's just, I think because I guess cost discussions probably are quite complicated. And so if, you know, it's good to set, you know, that I'm the medical person answering medical questions, and there is someone who can help, who can actually have a proper discussion about the breakdown of costs. But I guess just as a sort of the idea, what I have in my mind is, you know, there's IVF costs. There's what you generally that IVF would cost. Then there's donor. If you're using an egg donor, you'd be paying for their sort of IVF, or going through a cycle to retrieve the eggs in order to get those eggs. So sort of, it's your own plus the donor fees.
I think that helps give people, I guess, the ballpark. But as you said, the most important thing is deciding whether it's right for you, if it's right for you, finding out all the legalities, getting the counselling support, you know, finding out if this feels right for you. And then obviously the next steps would be to see someone like yourself and just have that initial discussion who can...
Yeah, I guess having an open mind. Exactly. Yeah, it's, you know, you never quite know at the start. And it's a little bit of a one step at a time and feeling your way through. And as you say, it's never the first. It's never plan A. It's never what people decide up front. But it often becomes sort of what they say is the best thing that they've done for themselves.
Yes. Yeah, I see two patients at the moment through their pregnancies with the donor eggs, and yeah, I've seen the babies previous pregnancies, and yeah, from my experience, which is probably relatively limited compared to thousands of people that probably used donor eggs, but has been absolutely wonderful experience, and watching them with their child, they just love that experience. So
yeah, absolutely. And yeah, I guess what we really want, and why I think it's really great to talk about this, is to increase awareness of how desperate people are for to get donor eggs. So if there's anyone out there listening who may have had a baby using IVF or in some other way, who may be able to relate to this and are sort of a bit tentative, or thinking maybe they would want to become an egg donor and sort of donate through to the clinic, or perhaps they have someone in mind that they might want to donate to, we sort of would welcome them with open arms and just give them the information that they need to see if it's right for them.
I actually met a beautiful girl at one of the presentations I was doing, just about egg quality and health, and she came up to me afterwards, and I was just talking to her about, as you do, about trying to create a family. She said, "So I don't want children," and she said she's done 3 already egg donation cycles, and that was her thing. I just thought it was so beautiful, and she was turning up to this presentation to get her egg quality as good as possible. I was just so blown away at
that. Is amazing.
I just thought, it was really amazing that someone would decide to, this is not for me, but I can see how important it is to someone else. And it was so important to her to be providing the healthy eggs that, she'd come along to an egg health presentation to help get her quality eggs. So, if anyone's listening, that
is inspiring.
Thinking about, that this could be an option for them, or as you said, I really love what you've done with your research into the egg freezing and whether that is a viable option that may help other people create their families.
And yeah, it's absolutely the most altruistic and generous, most amazing gift that I think you can give someone, really.
Yeah, absolutely. Well, is there anything you'd like to leave us with today? I feel like we've covered a lot, and I hope I'm seeing some hearts and things come through. So I hope everyone's really got a lot out of this discussion.
Quite distracting, isn't it, watching
It's lovely, though. It's lovely.
It is lovely.
I think
keep them coming.
Exactly, like love confetti. It's lovely. I'm glad everyone's enjoyed it. So I guess next steps, if someone wants to see you, your consult out of East Melbourne and your private rooms in the Mornington Peninsula. Right?
Yeah, and there's lots of us fertility specialists around. So don't hesitate. Just if you want to be more informed, either on the recipient or the donor side, get the information. It could be the most amazing thing that you do.
Yeah. Excellent. Well, thank you so much for taking the time out of your busy schedule. I know it's like Tetris finding time to do these things, but I really appreciate you making the time, because it's such valuable information that you have to share for everyone. So if you do have any questions for either of us, feel free to shoot us a message, and we'll be sure to have more of these. If you want more information on general egg quality, grab the free checklist in my bio. And thanks again, Genia, for joining us. It's been wonderful.
Thank you. Thanks so much for having me. Thank you to everyone.
Bye.